In the wake of increased exits of pharmaceutical companies from Nigeria, with varying reasons such as an unfavorable business environment and record losses, which has invariably led to a sporadic rise in the cost of pharmaceuticals, Project Pink Blue in Abuja held a symposium themed Economy, Tax and Cancer Control, the exit of pharmaceutical companies from Nigeria, for stakeholders to engage on ways forward to curb the exits and reduce the potential threats to pharmaceutical inflation in Nigeria.
Cancer today has remained a disease that is not integrated into the healthcare. In the US, for instance, people who have cancer, breast cancer for instance, have 80% chances of surviving this disease. But in a country like Nigeria and so many other countries across Africa, people have less than 30% of surviving. This is something we're all going to think about. This is something we need to make some effort to really close this gap.
Outside the Cancer Access Fund, we have Cancer Health Fund, which is an initiative of the last National Assembly, the 9th Assembly. We brought fruition that Cancer Health Fund, where we want to create a fund, a pot of funds, where federal government make contribution, but private sectors, drug manufacturers and so on, also make contribution to be able to address 3 cancers that are common among the indigents. That is cancer of the cervix, cancer of the breast, and cancer of the prostate in men. There is a budget line known as Cancer Fund for breast, cervical, and prostate. Because when the government contribute that money, the private sectors, drug manufacturers, particularly Roche, they are willing to be able to subsidize the drug by 50% based on that contribution. But the money from government is for diagnosis and for care. When we say care, it's not only drug treatment, it's also include transport for people to be. 6 hospitals have been selected across the country. The aim was in 2024, they should increase to 12 hospitals to reduce the distance so that to increase access. So if we have this money, because we are talking of the economy, that will be able to help to, at least for those people that are indigent. All the cancer drugs that I am aware of, none is manufactured in Nigeria, they are imported. None.
Is our collective responsibility. Affordable and effective treatments is a shared responsibility that involves both the public and the private sector. But there is multiple taxation because it's also not fair. The pharmaceutical companies have to pay for raw materials, for active pharmaceutical ingredients, for packaging materials. All of this adds up to the final cost. And therefore you find that local production is more expensive than importation. So there's almost a disincentive to manufacture locally. But if there's anything we learned from COVID-19 is that we should never waste a crisis. We realized that we were, as a country, medicine insecure, and it is our responsibility, not only of government, but a collective responsibility to ensure that medicine security is ours, which means we must have a thriving local pharmaceutical industry, regardless of whether it's slightly more expensive, and policies that buy Nigerian for Nigerian, and all of us should start to buy Nigeria and made in Nigeria. We also need to review our price regulatory policies under cancer medicines and vaccines. We would like to advocate for a zero duty on all life-saving equipment and all life-saving pharmaceuticals, vaccines and chemotherapy agents. But this will be regulated in such a way that whatever savings government provides the private sector will be passed on to ensure that it is not abused. Our DNA is different from the DNA of a German, of an American, and of a British citizen. And therefore, we buying 70% of our drugs from India, we do not have the same DNA, and therefore we do need to test. Provide additional funding from the private sector. And this is something that we still need to push, and we need to be able to expand the program beyond the 3 cancers and beyond the 6 existing hospitals. So it's expansion of that. And this, on the next slide, just shows you some of the benefits of the Cancer Health Fund. Most importantly, providing access to high-quality cancer care to the poor and most vulnerable patients across our country. And not it needs immediate action. It is not a death sentence. There actually may be an opportunity. But if we as Nigerians, especially those of us in the private sector, see it as a challenge, you should take it as an opportunity. We need to make sure that when they exit, that it is Nigerian businesses that are taking over the distribution and the marketing. Otherwise, another expatriate company will come in and take over, and it's already happening. We need those physical and non-physical incentives to have Nigerian, proudly Nigerian, local production of life-saving drugs. We need to fast-track the implementation of the new 6 centers of radiotherapy. We need the duty waivers on the life-saving equipment. We need to ensure medical and medicine security by producing locally, distributing locally, and promoting locally. We need to be an advocate of Made in Nigeria.